All right, take 34. Here we are trying to get our IT department all squared away, and it's all because we have no storage on the iPad. Too many podcasts, I guess.
Oh, bummer.
Oh, bummer. You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast. So, hey everybody, welcome back to another episode of the NeuroRESET podcast. We are with a special guest, Kelly Williams. She is a corrective exercise specialist here in the Valley, actually fairly close to our office, more downtown Phoenix. I will not do it justice to explain exactly what she does, so I will let her do that, and we will tell you how to connect with her, how to make an appointment with her, and if you know anybody dealing with anything that maybe either one of us can help with, just reach out and give us a call. But without further ado, Kelly, please introduce yourself.
Well, thank you very much for having me on the show today. So my name is Kelly Williams, and my business is Restorative Fitness, and it focuses only on corrective exercise services. So I'm a corrective exercise specialist, and most people, when I tell them that, they kind of blink at me, and then I follow up with, yes, I hang out with the unicorns on Friday. There's not very many of us, and I know what I do is kind of mystical, but it's really not. So one of the easier ways to kind of explain what corrective exercise is I say it's exercise coaching that focuses only on joint and muscle health. And that's really the easy way to get around it. We have much more higher up level, difficult explanations, but that's really what I think people can really take away and understand. So I always tell people abs are nice, but having a better back is really what I like to do. And so, when we're talking about exercise for joint health, people are like, oh, well, isn't that physical therapy or isn't that chiropractic? And it's not. It's literally using exercises and stretches and self-myofascial release to help joints be in a better position, to help the soft tissue around joints support it better so we have better joint movement and less discomfort and chronic stiffness in the muscles. That's in a nutshell.
So if we were to compare what you're doing to PT, right? Mm-hmm. Let's say we have a shoulder issue, and right. I know it's a can of worms, right? Let's talk where I would imagine, and a lot of people listening might imagine, you're doing large movements with like lightweight. Mm-hmm. What would be the difference that you would do in like that situation?
So I think step one on that is to talk about what I see the difference between corrective exercise and physical therapy to be, because it is really gray, right? It is really gray. So one way to think about
overlap. There's a lot of overlap.
There is a lot of overlap, but I think the difference comes in what we're focusing on. So physical therapy, for the most part, is focusing on trying to heal something, trying to fix something, a torn meniscus, a rotator cuff tear, coming out of surgery, rehabbing a joint, that type of stuff. Like PT, physical...
Like getting you back to play kind of thing?
Yeah, getting whatever the thing is, the joint, the injury, back to a place where it's movable and it's whole again. Corrective exercise is going to take it from that next step. So now that you don't have this medical injury, what's going on around that joint? A lot of people that get out of physical therapy still have balance issues. They still have pain and discomfort in that area and around those areas. So what do you do? And that's really where corrective exercise steps up, because we're not focusing, if you come in with knee pain, we're not going to focus just on doing exercises, stretches for your knee. You probably have already done that in physical therapy or done it on your own. We're going to look at that entire chain in that system, and we're going to work on creating balance there.
So how far does the chain go? Let's say if it was a knee. Does it connect to everything?
Yeah, it goes all the way up and down. So that's part of the assessment process, and what I do is looking at how far are we chasing this, right? Mm-hmm. If you've got a left knee issue, I'm instantly going to look at your ankle and your hip, right? If I find stuff there, I'm going to look at your lumbar. I'm going to work my way up, down into your foot. We all have stuff that's going on. Like I have a left shoulder issue and I've got a left knee issue, but they're not always directly related. And so whatever that thing is that you want to work on or improve, that's what corrective exercise is going to focus on. So we're only going to go in that area that we need to. So that's one on kind of the difference between physical therapy and corrective exercise. And two, if somebody comes in with a lot of high level of pain, that's not a corrective exercise type of solution. So if your pain level is an 8, 9, or 10, there's not a lot that a corrective exercise specialist can do to really help you. You're probably going to need to go down some sort of medical route, some sort of intervention through a different type of practitioner to get that pain managed, and then come back and we can work on moving the joint, stabilizing the joint in a healthy way. Now, to get to the second part of your question about big movements, no. Most of the work that we do, people call it yoga, people call it Pilates, and that's because a lot of it's either on the massage table or it's on the mat in the office. And it's not those, because those types of exercise formats have a very stylized type of approach to exercise, and it's not that at all. It's whatever exercise we need to do to get stabilization back in the joint, to get the joint to be moving better, to get the muscle group that is around the joint to be healthy again. So it's very gentle. I do sometimes call it gentle exercise that's focusing on recreating a healthy reaction between the nervous system and the muscular and skeletal system to get into a healthy range.
Awesome. Excellent. So how long have you been doing this?
12 years, but I've been doing it full time for 6 years.
Awesome.
And it's one of the best choices I've ever made.
Right on. Very cool. So what kinds of, you touched base, let's say anything under 7 and under in pain scale, 6 and under pain scale, something like that, could be a customer of yours or a client of yours. What are some things, help us understand maybe a handful of clients that you've worked with over the last 6 to 12 months?
Well, here's the thing. So I do corrective exercise on the bigger scale, specifically because I want to help people live a really healthy, active lifestyle. And, pain makes your world small. So clients that come in are people that have chronic joint and muscle discomfort or pain. 1. 2, they're irritated by it. They're not accepting it. A lot of people accept joint pain and stiffness as just, this is how it is at this age, or I already had that injury and that's just how it is, and they accept it. So 1, they have pain. 2, they're annoyed by it. And 3, they want to do something about it. They believe that they can do something about it. I'm always teaching clients, let's get that joint into a position or into a moving, kind of pattern that's best for you for what you're doing. So I have clients across the board. I have clients as young as 26 all the way up to 86. And they're coming in with everything: ankle issues, knee issues, shoulder issues. And we're talking about pain or discomfort. It could be from just an everyday thing that they experienced, no formal injury. It could be for somebody that just got out of physical therapy. It could be for someone that had an injury, but it's not really injured enough to qualify for physical therapy. Somebody that just developed something 3 months ago, someone that's had lumbar, low back issues on and off for 6 years. So it's pretty much anyone that's got chronic muscle joint discomfort, but they don't need medical intervention to help with it.
So pre or post surgery stuff is fine?
Absolutely.
Cool.
And I will refer you out though if I'm like, no, that's not something that we can help with.
Sure.
So,
sure.
yeah.
So do you remember how we met?
Yes, we had
Was it Margarita?
Yes.
Yeah. Okay. So we had a gosh, I don't know who was working with her first, but
probably both of us.
Yeah, it was probably very similar times. I know her daughter is big in the biohacking world. She's also kind of in the biohacking world, and she's like, I'm just trying all the things. So she was working with you, she was working with us, and she had a specific condition. I can't share it because she's not here, but I think in the grand scheme of things, everything that we were doing was helping. Right?
Absolutely.
And that's kind of what I want to touch on is, for me, we are in that I have a major problem. We need a medical intervention kind of thing, whether it's a disc issue and we have a herniation, a protrusion, or a disc bulge, right? And that's the thing that's causing the pain.
Yep.
Then we rehab that. And then for me, in a situation like that, then I'd refer over to you.
Right.
Right. In terms of like the neurological side of things is where people might not understand when to go or when to ask for a referral, or anybody listening. It's like, if you're in a position where, hey, this is helping, but I still experience XYZ pretty consistently, I can only get to this level. Either one of us could probably help them get to that next level as well.
Right.
And so one thing we were chatting about a little beforehand was, do you know anyone that has gone to PT, has had surgeries, has had decompression, has had this, they exercise all the time, they live a life that's normal, but they always have chronic tension or chronic achiness or strain or pain in a certain area. Neck and shoulders is probably one of the most common. Right. Low back, because it's just not very stable for most people.
It's but the middle of us.
Yeah, and the neck and the shoulders is where most people hold their stress, right? So when you work with someone, in that situation, what are some things that you end up doing?
That's a really good question. So anytime a new client comes in, I have an initial assessment process, and that's really for me to really get a good sense of what I'm dealing with here. How much of this is what I call a biological, physiological issue, and how much of this is more of a nervous system or a neurological issue? Because yes, if you've got a neurological condition happening, that can impact the tightness and the muscle imbalances, or tightness of muscles and imbalances that are happening around joints. So I need to be able to differentiate how much of this we can actually work with and do, how much of this is outside of my scope. And so one of the things that, if I see if it's outside of my scope, I refer it out to people like yourself. But one of the things that really cues me off to this is not really something that we can, address directly with corrective exercise in the assessment is one, where people are feeling their tension. If during our 1 hour assessment, that is constantly moving, right? Like, oh, it's up here when I'm doing upper body stuff, but now it's down here and I'm doing lower body stuff and this feels fine. If it's constantly moving, that's going to be a cue to me that something's like, that's not typically how this goes, right?
Like that's more of a nervous system.
Yeah, nervous
thing.
system
Yeah.
or neurological or something that's outside of my scope. The other thing is that if the work that we do, so we can identify an area that's tight, let's say it is the upper trap, right, kind of around the neck, and I can see that there's some postural issues going on in terms of joint alignment and some muscle imbalances. Can we, in that assessment, with the little bit of work that we do, can we get that to kind of change? Can we get the soft tissue to respond? Can we get it to do what we want it to do? And if it does pretty quickly, that's great. If it won't, or it goes right back into it, or and it feels worse, that's going to be, again, my cue that I'm like, there's something that's not really something I can work with. Now, let's put those aside. Let's say there is something I can work with. Number one is there's a type of breathing that we use in corrective exercise. It's called 360 breathing. It's nothing special. It's just what we call it, but it's diaphragmatic breathing, but not just with your diaphragm, using both your lungs and your diaphragm to get full expansion through your torso, through your thorax, to really pressurize and rebalance a lot. So that in and of itself is not just to breathe and relax someone. It's A, to repressurize this area, to kind of reset it, and B, to get some of that vagus nerve stimulated just a little bit with that breathing and see if we can use that to get anything to calm down. If I'm seeing that none of that's really working, it's probably going to be outside of my scope.
So I want to say it was maybe 5-6 years ago, and as I was working through a case, and I'm like, something's weird about this. Like everything was checked out with this low back case, and I'm like, they're not responding. And somewhere, I can't remember what I came up with, but it was like a muscle that hit me, or that I found understood is helping with breathing, that I had no idea was helping with breathing. The psoas.
Yeah.
Had no idea. So what's cool, so I always call the psoas the tenderloin, because that's what it is in like cows and things like that, right?
Yeah.
But because it's so deep and it's never going to see the light of day, I would say that's why it's tender, right? But it has such an intense function, and I'm sure you find this all the time.
Right.
And a lot of people say, oh, well, it's like the sitters that are chronically sitting, it's going to have a short psoas, and so they stand up, they go into extension too much, and da-da-da-da-da. But I didn't realize how much it had to do with breathing. Could you just, for my sake, just elaborate on that a little bit?
Absolutely. So the psoas, besides attaching to the lumbar, also fascially blends into the diaphragm. Mm-hmm. So, fascia is a big part of corrective exercise too. It's not something we talk about a ton in mainstream. Mm-hmm. So people are like, oh, I'm not sure what that is. But basically that connective tissue that connects everything inside of you, right? So the psoas is so importantly into your diaphragm fascia, but also into your pelvic floor. Mm-hmm. So all of that stabilization that happens between that kind of mid-spine down into your pelvis, your psoas is a part of that, of how it actually moves when you do your breathing, when you're doing proper diaphragmatic breathing and we're getting that expansion, top to bottom, front to back, side to side. That psoas gets palpitated just a little bit, and that movement kind of pulls a little bit on our pelvic floor, pulls a little bit on our diaphragm, and that keeps blood flow through there, helps keep organ motility through there, like all of that stuff. And so our psoas isn't just about a hip flexor, it's more about a lumbar stabilizer, but also a pelvic, or the connection, diaphragm to pelvic floor connection too. So
interesting, love it. You mentioned fascia. You've said it a few times. I cannot remember who I was talking to or listening to. I want to say it was another podcast. And some research more recently is starting to understand the role of fascia. Like they're starting to look at fascia like fiber optic cables.
Yep.
And I can't remember who I was listening to, but if I can think about it, I'll plug it into the bottom of this podcast for the link or something. But yeah, so how much of what you're doing is exercise versus fascia?
It's both. So if I had to kind of tell you the things that we do in a corrective exercise session, so one would be myofascial release. So that's fascia, right? So we're looking at releasing anywhere that there's adhesions in fascia, where there's knots in fascia, where there's tight fascia. And a good example, and it's a really oversimplified one, but it really works well for my clients, is I'll tell people like, okay, so my arm is muscle and my jacket is fascia, right? So every single muscle has fascia that goes over it, but notice how my jacket doesn't just stop at my elbow, it goes all the way down to my torso, right? So fascia really connects all of us. So when you're having issues, muscle discomfort or pain in one area, your fascia that's connected to that is going to be a part of that. So we absolutely have to address the fascia when we're working with any kind of tight muscles. And so we do myofascial release. When we do exercises, that's focusing more on proper muscle engagement, like looking at how well the nervous system is communicating to our muscles to do the right action and that type of stuff. So we might do corrective exercise, we might do myofascial release, and then we might do some diaphragmatic breathing to help with any of that. So
very cool. Very cool. Let me see. Where do I want to go with this next one? I don't know. When we were trying to save a bunch of stuff because we met for a few minutes before this, and on one hand, there's a when to refer, right? But also, when might you be more successful with one or the other, right? So I'm going to start this off because I'm the nervous system guy, right? And for what it's worth, we just started with a new device today. It's an awesome device. It basically tests the entire autonomic nervous system. Not the nervous system, the autonomic nervous system. So all the stuff that happens behind the scenes, your heart rate, blood pressure, arterial dilation, bronchial stuff, vagal responses, tilt table, deep breathing, and it can calculate all these different things and give you readouts on physical stress, mental stress, health of your system, of your vessels, and start to basically identify maybe some early signs, or if you're just stubborn and you don't usually go to the doctor, like, you can identify problems in your cardiovascular system. And so what it does is it pairs the neurological evaluation that we've always done with the autonomic evaluation that we just haven't had the ability to do. And it helps us really understand the combination between the two, the nervous system and the autonomic system. And the reason I bring this up is because we literally just got done with a new patient evaluating this person that is having basically syncopal or like lightheaded pass out types of sessions or episodes. And they're happening more frequently and more frequently to the point where they're basically every single day. And so we go through the history, we identify some things in the history that might have been a causative factor, but it's not direct, so nobody thought about it. As we're talking years prior, something happened and symptoms start to occur more and more and more. And then you ask certain types of questions that are like, oh, okay, this is very much part of the same system. Meaning that like our amygdala, fear, fight or flight system, when that sucker becomes active, basically any symptom is possible, right? And so going back to the tight muscles, this individual was like literally off the charts for physical imbalance symptoms, if that makes sense. Like the physical stress of their humanism was off the charts. And their symptoms are, my body gives out, I basically all but pass out. I have to lay on the ground or else I will pass out and fall and hit my head. They can't do things that they wish they could do because of this. There's a fear and stress on top of the fear and stress of whatever has happened before. So stressful events or normal stress from day to day can cause all of these adhesions, fascial issues, structural issues. Anytime you have a majorly stressful event or a chronic stress that's above the level of being able to heal, you're always going to develop these joint problems. right? Its spine is the most common because it's being used all the time and gravity is always against us. But the simple things, you lift your arm, you take a twist, you pick up your purse, you open the car door, you turn your head to check your parking spot, bend over and tie your shoe, and all these things go.
Yep.
Right? In my mind, because, I'm biased, I would say that working with you is huge to get the mechanics working while we're trying to fix the problem.
Absolutely.
On the flip side, there's the neurological piece or the autonomic and stress management piece. When you say stress management, it's like, don't stress out. It's not that. It's your fight or flight system is so active that you literally cannot go into the healing side of things, which is our rest and digest, right? And so we were able to identify this with this new piece of equipment and literally show them, boom, 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 boom. Here's all the orange and red. And this is exactly like fitting up with your symptoms. So this person went to cardiology, rheumatology, basically every doc you can think of, totally normal. There's nothing wrong with your heart. There's nothing wrong with your this. There's nothing wrong with your that. So what the hell is it? Right? And so now that we have this device, we literally just got it in yesterday, went through hours of training on it. And the first time we run it today, it's like something didn't work. So we're like, great. And so we had to rerun it, and we were able to rerun it, work perfectly, and and it was like the ticket to the game.
Cool.
And so we were able to see that. And so what I'm hoping is this individual, we're going to clear out all the nervous system stuff, and then they have some other orthopedic stuff that at this time, it's not even close to their biggest concern, but it's going to become their biggest concern very quickly. And we were talking about other cases where they came in to see me for this, and like we corrected that problem, and then now they're complaining about this other thing, and they're like, well, now we got to do the same thing for this.
Right.
So it's it's like your nervous system is always going to identify the biggest thing. And then if something comes after that, it was probably always there. It's just we're knocking down these dominoes and we're correcting these things as we move forward.
Well,
right?
I'm so glad that you say that, because I just had this conversation with another colleague. We were doing an Instagram live on the subject about like a client will come in. And again, they always have life goals. They're like, I have knee issues and I'm going to Europe and I know I'm going to do stairs. I need to get my knees like stair ready. It's like, okay, let's do it. They'll come in, they'll work. Let's say we spend 3 months on it. They'll have success. They'll go to Europe. They'll have the best time of their life that they never thought they could do. And then they'll come back and they'll be like, all of a sudden my shoulder is a big problem.
I think I messed up my shoulder in Europe,
right?
Or something like that.
Or just like, I'm not sure where this came from. And I tell them the exact same thing you just said. I'm like, it was probably always there, but this was either with your focus, this is what you were focused on, or this was a bigger problem. So your system's going to focus on that. And so I'll be like, okay, so now we're going to do that same system we did for this. We're going to do it for this. And for some reason, at that point, they kind of
they start like their search again.
Yeah.
Right? So they start hitting up all the other doctors or practitioners or therapists or whatever, manual or whatever it is. It's like you start the routine again. And they often go primary makes a referral. Then I can't get in. And then I get referred to this person. And then I get referred to this person. And it's like the problem isn't necessarily a big problem. Or if it is, it's just hard, because I know you see people that go through the gamut. They go through so many different practitioners before they get to you.
Right.
And we're very much similar. We're like the end of the road for most people. They're out of money. They this and that, and it's
Patience.
like it's common. They're like, if this doesn't work, I don't know what I'm going to do. Right. And so for me, it makes sense. The thing that helped with this very well could help with that. So let's just start there.
Right.
At least you have the relationship, you've built the trust, and then one of us or whoever it is going to say, hey, you know what? This isn't what I can help you with. But that's all that whole evaluation,
Absolutely.
So that's interesting. I'm glad you deal with it too. So, okay, let's see. What are your thoughts on that nervous system thing? What kind of role do you see that playing in what you're doing?
Okay. So I was thinking about this when you were talking about it earlier. So, there is to the body, right? Your muscles, your joints, your muscles and joints are designed to work and move in a certain way, to extend a certain length and to shorten a certain length. And they all operate off of what your nervous system tells them to do. And so I always tell people this. They're like, oh, I'm not sure why this happens, or it just decided to do this. I'm like, no. Like there is a relationship between what your joints are doing, your muscles, and your nervous system. Those three areas, right? Obviously, with corrective exercise, the specialty is more of what's happening with the joint movement, how well is the joint moving, what's the health like of the soft tissue, how well is it moving, and then how well are the muscles and the joints receiving that neural, messaging. Now, if there's something off there, that's not a lot that I can deal with. And so let's say somebody literally had a postural issue with their knees, right? They
go up the stairs and their knee hurts.
Right. And
walking
so
normally is fine.
And they've lost internal femur rotation. Their pelvis isn't getting rotation in their gait. So it's like, okay, all soft tissue, all bones, joints, we can work with that. And then we fix that. And now they're talking about their shoulder, and it's different. I have to reassess every time we move to a new part of the body because it might be different. That shoulder might be elevated, right? And this is what's creating the issue. So every time they're trying to get up overhead, they're having impingement issues and pain in the neck. But I have to reassess, like, is there something going on in terms of like neural impingement in the neck that's creating some of that tension? Is it your stress? I see a lot of people with balance issues, and the way that they respond to feeling uneasy and feeling tippy is a lift up in the shoulders, right? And a tightening through the neck. And so I have to decide how much of that is something that we can actually do structurally and muscle wise, and versus how much of that is going to be through your nervous system or vestibular. I see a lot of that too. People will come in and they're like, I feel like I'm off balance, and I can see that they've got some posture issues with their joints and some muscle imbalances, but the more they describe what they're saying, I'm like, that's vestibular, there's no amount of exercise that we can really do to fix your knees and your hips to really help with that. So like it has to be a biological thing that I can help with.
For sure. On the vestibular side of things, it's a good point to bring up. When people come in, we try to explain a concept of your nervous system loves to know where you are in space.
Yes.
Right? So we have our whole feedback proprioceptive system, our eyes and our inner ear. Excuse me. And so I'll even take it further to say we'd love to know what's going on in our body too, right? Our brain loves to know. So if we have a symptom that causes a fight or flight response, and then all of a sudden, like, oh, I got this heart palpitation, which you may have experienced at some point in your life, right? It's like that heart palpitation, it's like, what's wrong? Fight or flight response. Now all of a sudden everything tightens up, right?
Right.
And so the body loves to know that everything's peachy, homeostasis. When it's not, it's going to fire that fight or flight response, right? So if our brain perceives us to, let's say, be a little further forward in our balance,
right,
we're going to fire more muscles to activate a reflex against that.
Correct.
In a very simple pattern, right? But then you take something like as simple as walking or gait, it's not very simple, right? So I describe walking or gait as a series of controlled falls. Right? So you have to understand vestibularly where you are in space. If you blink your eyes, or if you close your eyes, or if you turn your head, you still have to have a sense of my body is still walking down the sidewalk, right? I just had somebody the other day make a comment because we pointed something out on an eval, and it was like, when you turn your head left on this balance platform, you destabilize significantly. So either you've got a vestibular issue or a neck issue. And they're like, that's weird and they're like a high-level athlete, like a CrossFit something or other. And they're like, when I was running the other day, or when I trail run something, when I look to my left, oftentimes I fall over. I'm like, what the heck? And so as we went through, I was like, well, might be a part of it. And then we look at the eyes and how that whole system and the coordination system, there wasn't a whole lot to find. But when you see the nuances and how her nervous system was responding to where she was in space, it made sense that from this old issue she had, she wasn't healing because she wasn't in a place to heal because she was too fight or flighty. Even though she wasn't stressed out, her nervous system was stressed out. And that's what so many people don't understand, at least when they come in to see me. Absolutely. They know something's wrong, but the two questions I usually ask, and one of them is on an intake, on a scale of 1 to 10, what level of stress do you have in your life? And a lot of them are anywhere between 4 and, say, 8. But then I ask, okay, what about your nervous system stress? Because that's that other internal sense of where your system is in space, right? Most of the time, it's higher than the normal external stressors. And so the higher that number is, the less we're able to heal. The higher that number is, the more, in my opinion, it's going to be harder for us to make a change in like a decompression case or a neck case, right? If they're just chronically stressing out for inside,
Right.
Even if they're like, I have no stress, I'm retired, life is great, but whatever the internal stressor is that's constantly cranking, they're not going to be able to heal and improve their stuff, or it's going to take a long time, right? I worked through those in the beginning with these orthopedic or chiro cases. It's always the same thing every week. And it's like they come in for chiro, and at the time we did separate exams. So we weren't able to fully address the neurological piece, which is now why somebody shows up. You could show up with a broken pinky and we're still going to do a full neuro exam.
Right.
Right. And so you just have to have that, I don't even want to call it metaphysical, but it's like the social, the psychological, the stress management, the understanding of trauma, the understanding of the body, right? It's like if you don't move, you need to move. Just get it moving is helpful, but then, it hurts when I move, great, go see you.
Right.
And that's how we address everything. And so that's just on the side of nervous system. I was just really excited about this new device that we got, so that's what took me down that rabbit hole. But I'm very curious to really, truly understand from your position when you can tell that somebody's stressed out just from like putting hands on them.
Well, one of the ways that I can tell is that if the work we're doing is progressing really, really slowly. Now, obviously in their intake, I do a full medical history on them as well. If there is any autoimmune conditions or anything like that going on, if they have any kind of metabolic issues, even circulation issues, all of these are going to impact even the work that we do in terms of how quickly they recover, how quickly they respond, how quickly they heal. But one thing I can tell that, this is really something that this is just your muscles are imbalanced, the joint issues are off versus something that's going on with the nervous system is their success. And not just in like the joint and the muscles feeling better, but how they respond. So a good example of this is my first client ever that I did corrective exercise on. So and this is like 13 years ago. So he had retired and was ready to start living life, but he needed to lose 100 pounds. And so he came to me to lose the weight. And we needed to do certain types of exercise for weight management, but he couldn't do any of them because of lumbar and knee issues. And so I was already in the corrective exercise world, and I was like, well, this is perfect. Let's just do some corrective exercise on your joints, and let's see. And just doing that, right? So just corrective exercise it as it is, brought his pain level down, increased his mobility, and his happiness and joy in life just exploded. And so he started taking dancing lessons. He met a girl. He got married. I never saw him again, and he never lost the weight. And that is a perfect example of how that was just a joint issue that we needed to manage, a joint soft tissue that we needed to manage versus something was going on neurologically or through his nervous system that wasn't allowing him to heal. So if somebody's not responding well or fast, or, they have some ups and some downs, that's definitely going to tell me that there's something going on with their healing and their ability to heal.
I know we'd shared a case last year, I think, and I think you'd mentioned giving me an update on that individual, and it was, they do really well for a couple days, and then everything comes back, and it's just this yo-yo. In your opinion, would that be a little neurologically mediated?
Yes.
Whether it's stress or call it nervous system is I guess the question, right?
It could be that. The longer I work with the person, the more I get a better sense for that is. But it could also be that they're just not adhering to homework. So I'm sure
do your homework, kids.
I was going to say, I'm sure your patients have homework. A huge part of corrective exercise being successful is you have to do your homework. You can't come see me for 2 hours a week, do everything really well, and then go back into your life doing the things the way you were doing and have success.
To get you there.
Right. So it could be that, or it could be that they're just not adhering to their homework. So.
Yeah. So if you don't use it, you lose it.
I say that all the time. I'm so glad you said that.
It totally makes sense, right? I always reference I think it's 40-year-old virgin, which is where they say it. But it's it's true. If you don't hit the gym, you can't expect to get stronger. If you don't hit the gym or eat right consistently, you can't expect to lose weight.
Right.
If you are... Sure. If, same thing, if you're going to somebody and paying money to get help and you're not listening, but only 20% of the time, you can only really expect maybe 20% of the outcome. Now, you might get lucky, like your first guy, where you work on it and the 20% that you worked on is 100% of the problem.
Right.
But these days, and I'm sure from 6 years ago, even when you started doing this full time, you've noticed a significant difference on how little there is just that one problem anymore.
That's why I'm making more and more referrals to you all the time.
Yeah, and we need to get people out of here to get the corrective stuff done too. I think what would be your send-off message, since we're getting cut off for time here?
This might sound a little negative, but I actually like it a lot. So I'm going to try it out with you guys.
Okay.
10 years from now, you're going to wish you had better standards for your joints.
Okay. There we go. I like that.
I see that and hear that every single day in the work that I do. People expressing remorse that they just wish that they had paid more attention to their joints. And that doesn't mean stretching a million times every day and doing hot flow yoga, but just paying attention to when something would talk to you and dealing with it. So,
to follow that up, we see a lot of people as they're retiring and things like that, and they have to just deal with their health. They can't live life the way that they had planned to, right? The golden years, they aren't so golden.
Yes.
And that's why, for me, I try to live life with as much fun and that I can now, because it might not be there. Anything could happen, right? But if you take action, you will see change, right? So, okay, but as we're wrapping up, why don't you tell everybody how to get in touch with you?
Sure. So all of my website and social media handles are the same. So it's Restorative Fitness AZ. That's the website. That's my Instagram, TikTok, LinkedIn. All of that is there. So come to the website. I do free consultations. If you think that something's going on and this might be a good option for you, I'm happy to meet with you. We can meet in person or online. We can chat about what's going on. I can let you know if I think that's a good idea. But
right
that's
on.
Way to do it.
Well, that's going to conclude the latest episode of the NeuroRESET podcast. Everybody, this is Kelly Williams with Restorative Fitness AZ, and we will see you next time. Thank you so much, Kelly. This was awesome.
Thank you.
All right, we'll see you guys next time.